Welcome back to Social Security Post. If you've been following the big news around Medicaid, this episode is one you don't want to miss. We're diving deep into a powerful interview where Senator John Barrasso defended the sweeping Medicaid cuts that were just signed into law under President Trump's latest tax and spending package. Millions of people could be affected, and we'll walk you through what's changing, who's at risk, and what happens next. Before we get started, please hit that like button and subscribe to Social Security Pods. We break down every major update around Social Security, Medicaid, SSI, SSDI, and SNAP in a way that's clear and easy to understand. And if you have any questions related to these programs, feel free to drop them in the comments. I personally read every one. President Trump recently signed the One Big Beautiful Bill Act, which is being described as one of the most ambitious federal tax and spending laws in recent memory. While headlines have mostly focused on the $4.4 trillion in tax cuts, another section of the law is getting serious attention: the massive changes to Medicaid. Specifically, the law includes $930 billion in Medicaid cuts over the next decade. This isn't just a budget trim. This is a fundamental shift in how Medicaid operates in the U.S. The bill gives more power to individual states, but takes away a significant portion of federal funding. It imposes new requirements on recipients, makes eligibility harder to maintain, and could lead to millions being dropped from coverage. This law matters because Medicaid is the largest public health insurance program in America, supporting over 80 million people, including children, pregnant women, seniors in long-term care, and people with disabilities. Reducing this support changes lives, and not for the better, according to critics. On Meet the Press, Senator John Barrasso, the second highest ranking Republican in the Senate, went on national television to defend these Medicaid cuts. He didn't back down. In fact, he called Medicaid bloated and misused, claiming the program had drifted far from its original mission. According to him, the program is supposed to support the most vulnerable, but over time, it's expanded to cover millions who he believes are able to work but choose not to. Barrasso stated that this new law puts Medicaid back on the right path. He praised the new work requirements, saying they would ensure that only those who truly need the help will receive it. He also emphasized the importance of stopping fraud, stating that millions are abusing the system or using it as a long-term handout rather than a short-term lifeline. But not everyone agrees with this perspective, and the numbers tell a much more complicated story. So what exactly do these Medicaid cuts involve? First, let's talk about the work requirements. Under this new law, any non-disabled adult between the ages of 18 and 64 must either be working, looking for a job, or enrolled in job training to qualify for Medicaid. This means that people in low-wage, unstable jobs who might miss a few work weeks or forget to report their hours could be kicked off the program. Second, eligibility reviews are now more aggressive. In many states, people will need to prove their income and employment every month instead of once a year. That opens the door to technical errors and dropped coverage, even for people who still qualify. Third, states will receive less federal funding. That means less money for hospitals, clinics, and services in areas that already struggle to meet basic health needs. These aren't just numbers, they're policies that could impact access to prenatal care, cancer treatment, addiction recovery, and emergency room visits. The Congressional Budget Office, CBO, which provides nonpartisan analysis of federal laws, has released a detailed forecast of how these Medicaid changes could play out. According to the CBO, around 10.5 million Americans could lose Medicaid coverage because of the new law. That's a huge number. Even more alarming, they project 7.8 million people may end up completely uninsured, no Medicaid, no private plan, nothing. The White House claims that about 5 million people will shift to private insurance or get coverage through their jobs, but independent fact checkers have pushed back, saying that number is inflated and unlikely. In truth, only a fraction of those losing Medicaid will find coverage elsewhere. For people in rural areas or those working part-time jobs without benefits, the transition won't be easy or even possible. The numbers are clear. This law is going to make healthcare harder to get for millions of low-income individuals and families. Let's talk about the people who will feel these changes most. In Florida, for example, Medicaid supports over 4 million residents, many of whom rely on it for basic medical needs. State health officials warn that with less federal money, hospitals may lose over $4 billion per year, forcing cuts in staff, services, and even closures. In rural areas where Medicaid funds up to 70% of a hospital's budget, this could be devastating. In Connecticut, one hospital administrator said the new rules could mean denying care to up to 30% of their current patients. Pediatricians are especially worried. Children with asthma, diabetes, or developmental delays rely on continuous Medicaid support for checkups, therapies, and medications. In Illinois, community health centers say work requirements will hit those who work inconsistent jobs like gig workers and seasonal laborers. These are people who are trying to work, but life isn't as predictable as the policy assumes. But the political response to these cuts has been anything but unified. While Republicans like Barrasso are praising the changes as necessary reforms, other conservatives, especially those in swing states, are starting to worry. That's because the backlash is coming fast. Town halls are filled with concerned voters, advocacy groups are organizing, even some Republican governors are hesitant to implement the harshest parts of the law. Meanwhile, Democrats are furious. They're accusing the GOP of robbing the poor to reward the rich, since the Medicaid cuts are paired with massive tax breaks for corporations and the wealthy. Several Democratic lawmakers have already introduced bills to reverse parts of the law or delay its implementation. The battle over Medicaid is becoming one of the central issues leading into the 2026 midterms, and neither side is backing down. A big part of Senator Barrasso's defense was about stopping fraud in the system. But how much fraud actually exists? According to official data from the Centers for Medicare and Medicaid Services, CMS, around 15% of Medicaid spending is classified as improper payments. That sounds bad at first, but here's the truth. Most of those are paperwork errors, not criminal activity. In fact, less than 1% of Medicaid spending is linked to actual fraud, like people intentionally lying to get benefits. That's a very small amount when you consider the size of the program. So while cleaning up the system is a valid goal, many experts argue that cutting off millions of people to catch a few bad actors is like using a sledgehammer to kill a mosquito. We need better oversight, but not at the expense of people's health and safety. Even though the law has been signed, the fight is far from over. Already, several civil rights and healthcare advocacy organizations have filed lawsuits to block the work requirements and challenge the eligibility restrictions. In states like New York, California, and Oregon, governors have said they will not implement the harshest measures, claiming they violate federal protections and will do more harm than good. The courts could end up deciding how much of the law actually takes effect. In the meantime, public resistance is growing. Petitions, protests, and media campaigns are already in motion, and the political cost of these Medicaid changes is becoming a real concern for lawmakers. While some Republicans see this as a win, others are beginning to realize that the human impact may come back to haunt them in the next election cycle. Thanks for watching this detailed breakdown on Social Security Post. The Medicaid cuts signed into law under President Trump's new tax and spending plan are not just numbers in a spreadsheet. They're decisions that could take healthcare away from millions of people. If you found this video helpful, please give it a thumbs up and subscribe to Social Security Post for more updates like this. We cover everything you need to know about Social Security, Medicaid, SSI, SSDI, and SNAP in a way that's straightforward and fact-based. And remember, if you have any questions about this story or about your own situation, drop them in the comments. I'll be replying personally.